And let's bring in epidemiologist and ABC News medical contributor Dr. John Brownstein for more on this. Dr. Brownstein, there's so much concern over the variants and the vaccine. Now we have this new study saying researchers found 7 new variants of the virus in the U.S. How worried should we be about that?
Yeah, morning, Diane. You're right. 7 growing lineages of this new coronavirus, right, found across this country. They've all gained a mutation at the exact same spot in their genes. This is a gene that influences how the virus enters the cell. So it's a clear evolutionary benefit. And it's interesting because these are all different variants, but all sort of converging towards the same evolution. There are a lot of open questions, right? We don't know fully if this is more transmissible or related to holiday travel. We just don't have that much data because we only sequence about 1% of the viruses that we're collecting. And so we just don't know much, but when we look at the UK variants, more transmissible, we're finding maybe more deadly. It's doubling every 10 days here in the US. That's concerning. And when you add in a layer in other types of variants, we have this concern, while at the same time states are starting to relax their guidances. That's a concern. We're seeing mask mandates getting removed, indoor dining increasing. We just can't quite go back to normalcy with these new variants increasing. We don't want to look like the UK, Israel, Ireland, Portugal, that all experienced these variants and the implications of having this much virus transmission in the community.
And the U.S. reached 2 million vaccines per day over the weekend. What do you think about that number? Is it enough, or do we need to be moving faster still?
I mean, we're well ahead of the target of 1.5 million a day that Biden administration set. So that's great. And we're also administering more doses. Over 75% are now getting out there. That's well above where we were a couple weeks ago. Still lots of improvements. We got to move some of the vaccines that were used for the long-term care facilities out to the communities. We're seeing that maybe we need to increase the numbers of inoculation centers, federally supported community centers. Also, FEMA is now getting involved. So there's additional issues, but additional capacity coming in. Obviously, the community vaccination centers are going to be key, mobile clinics, now the pharmacies. And this is all to say that the vaccine still works against these variants, right? We've seen increasingly the impact of vaccination in Israel, where now we're seeing a decrease in 94% of the cases because the vaccine is rolled out so well. So we'd love to see that happen in the U.S. as well.
Yeah, we sure would. So this weekend was the first that CVS and Walgreens were administering vaccines. I know you actually worked with Walgreens on their pandemic response. So how do you think the pharmacy rollout is going so far, and how do you expect it to evolve?
Well, so far so good. It's very slow because they're really only targeting about 6,500 retail pharmacies. But this really is a new phase of this pandemic, right? The drugstores, the grocery chains, they're all going to be getting about 1 million doses a week to start, but that will increase. And we know pharmacies are a big point of healthcare delivery in this country. So the ability to have access to pharmacies, pharmacies already do the delivery of flu shots and a range of other vaccines, so they know how to do this. And we know that about 80% of Americans live within 5 to 10 miles of a pharmacy. So in terms of access, this will make a big difference. Now, I'll just say that we still have important vaccine deserts in this country. So access won't be for everyone. And especially when you look at Black communities, they're often served by independent pharmacies. They may not have vaccine right away. So still some challenges and gaps, but of course these pharmacies will play such an important role.
And now on Friday, the CDC released its long-awaited guidelines on reopening schools. Now, critics say there's too much focus on distance and cleaning surfaces and not enough on ventilation. And they say that this essentially will prevent schools from being able to go back full time. What do you make of the guidance?
Yeah, it's a real challenge. I mean, CDC had to sort of go down the middle of the road, and no one is happy at the end of the day. What is good about the CDC guidance is it's finally a really measured, data-driven approach to getting schools open. There's a focus on masking, physical distancing, what we call podding, getting kids in small groups together, hand washing. Yes, not enough on ventilation. It was mentioned, but it clearly wasn't a focus. But we did see mentions of contact tracing and testing, finally seeing those kinds of recommendations coming in. They created this color-coded chart, and it's based on transmission in the community, but also how well schools can do. It's also put importance of teachers to get vaccinated, but not making it critical. So schools could reopen without teachers actually being vaccinated. So that's a point of debate. A couple other areas of debate, of course, they put 6 feet of distance requirement. Studies have shown that 3 feet actually could work. And then this other issue of community-based transmission. We know that schools actually can do a pretty good job even when there's a lot of transmission in the community. But right now, based on the guidance CDC put out there, over 90% of communities couldn't have schools open right now based on the amount of virus that's being transmitted. Clearly, what it comes down to is we need to prioritize our teachers to get vaccinated if we're going to get through this and open up our schools.
All right, Dr. John Brownstein, great to hear from you. Thank you.
Thank you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.